What is breast cancer? Breast cancer is a potentially deadly disease where cancerous cells form in the tissue of a person's breast. Breast cancer is currently the most invasive cancer diagnosed in women, but is only the second leading cause of cancer deaths behind lung cancer. From 2012 to 2016, 15.5% of all cancer diagnoses in women were breast cancer. And although breast cancer is thought to be a woman's only disease, that's actually false. Thousands of men every year are diagnosed with a form of breast cancer. Cancer is caused by the uncontrolled growth of abnormal cells in the body. It develops when the body's normal control mechanism stops working. Old cells do not die and instead grow out of control, forming new abnormal cells. These extra cells may form a mass of tissue called a tumor. Women who carry certain mutations in the BRCA1 and BRCA2 genes have a higher chance of developing breast cancer, ovarian cancer, or both. These genes are inherited from their parents. When it comes to risk factors for breast cancer, there are two different categories. There are genetic risk factors, which are things about you that you cannot change because they are genetic. And then there's lifestyle risk factors, things about yourself that you can change to help decrease your chances of developing breast cancer. For the next few slides, we're going to talk about the genetic risk factors. First, let's talk about the biggest genetic risk factor, your age. As you get older, your chances of developing breast cancer increase. According to the American Cancer Society, 1 out of 8 invasive breast cancers develop in women younger than 45. 2 out of 3 invasive breast cancers are found in women 55 and older. A few easy lifestyle changes can help lower your chances as you get older. To maintain a healthy weight by eating healthy and exercising regularly, avoiding alcohol and smoking. Now, the next major genetic risk factor is your race. No particular race is immune from developing cancer, but it seems that certain races are more inclined to develop it. Breast cancer affects white women more than black, Hispanic, or Asian women, but unfortunately, the mortality rate for breast cancer is higher amongst black women than any other race. Now, let's talk about the risk factors you can control. To help lower your chances of developing breast cancer at any age, your best lifestyle change should be regarding your health. By eating healthier, exercising regularly, and avoiding smoking and drinking alcohol, you drastically decrease your chances of developing breast cancer. Your diet is said to be responsible for 30 to 40% of all cancer development. Not only does being overweight and obese put you more at risk, it also increases your chances of reoccurrence after remission. Breast cancer in men. Most of the men who develop breast cancer develop infiltrating ductal carcinoma, which means cells in or around the ducts begin to invade surrounding tissue. In very rare cases, a man will be diagnosed with inflammatory breast cancer of the nipple. Symptoms of breast cancer. Like most cancers, breast cancer has a list of fairly common symptoms. Some of those are pain in the armpits or breast that does not change with the monthly cycle, a rash around or on one of the nipples, discharge from a nipple possibly containing blood, a change in the size or shape of the breast, peeling, flaking, or scaling of the skin on the breast or the nipple. And the most telling sign in breast cancer is physical changes to your breast or nipple. It is important to see your doctor if you notice any changes to your breast, nipple, or the skin around your breast. It is also important to note that it is not uncommon to have no symptoms at all at the time of diagnosis. This is why it's very important to do self-checks regularly and have mammograms done when necessary.
The early detection stage. It is important for women to know the signs and symptoms that lead to breast cancer at an early stage, because if it's found early, the survival rate can rank up to the high 90s. Some changes women should look out for is how the breast or nipple feels or looks, nipple discharge, breast pain, and breast cysts. Although cysts can feel like lumps, they are filled with fluid rather than cancerous cells. There are different types of breast cancer tests. A mammogram is an X-ray of the breast. These are often used in early detection because they can detect signs of breast cancer years before a patient is diagnosed. Women should be getting these tests regularly, even if they're completely healthy. A breast MRI captures detailed pictures of the breast. These can also be used alongside a mammogram. Breast core biopsy. This is a procedure that removes a small part of the tissue using a special needle, which is then sent for testing. Sentinel node biopsy. This is a new procedure that evaluates lymph nodes and determines if the patient should undergo chemotherapy. There is also an easy test at home that women can use to detect early signs of breast cancer. This test consists of 4 steps. Start out by looking at your breast in a mirror. Keep your shoulders straight and place your hands on your hips. Look for any visible changes, such as inverted nipple or rashes. Next, raise your arms above your head and look for any nipple fluid or discharge. For the next step, you want to lay down and feel your breast for any unusual lumps. Make sure to cover all areas of the breast, and to ensure that you can follow an easy pattern. For the final step, you want to use the same pattern used in step 3 to feel your breast sitting up. Many women find it easier to do this in the shower. There are 2 most commonly used lab tests when detecting for breast cancer. The first is the hormone receptor test. This test is usually given to patients that are diagnosed with invasive breast cancer. The hormone receptor test uses a specialized staining process on a breast tissue sample to see if hormone receptors are present. Hormone receptors are a special protein found on the surface or within a cell. The next is the HER2 test. Like the hormone receptor test, the HER2 test searches for a specific type of protein that is found within certain kinds of cancerous cell. However, in some cases, the HER2 gene isn't functioning properly, and this test can help determine if the cell is normal or if it has too much of the HER2 protein.
A cancer diagnosis is not one that anyone wants to hear, but for many, it is their reality. It is important that those who are diagnosed have a strong support system around them, as their journey is not an easy one. If someone you know or a loved one is struggling with a recent diagnosis, there are numerous counselors and oncology social workers that can help cope with the life after diagnosis, as well as local and national support groups. No one should have to fight this battle alone.
There are 4 stages of breast cancer. Stage 1 is when a breast cancer tumor is found but not present in any lymph nodes. Stage 1 consists of 2 subcategories, Stage 1A and 1B. Stage 2 includes the tumor being 2 to 5 centimeters, or when the cancer has spread to the lymph nodes. The 2 subcategories are Stage 2A and 2B. Stage 3 includes a tumor being over 2 inches, and the cancer in the lymph nodes are extensive. The 3 subcategories are Stage 3A, 3B, and 3C. Stage 4 is the most advanced stage and is where the cancer has spread to distant lymph nodes and other organs of the body. There are no subcategories in this stage and can sometimes be recurrent breast cancer. The different types of treatment that can be used on patients vary on what type of cancer the patient has and how well the patient will react to the treatment. The 2 most common treatments are chemotherapy and surgery. Chemotherapy requires the patient to take a drug that can shrink or kill cancer cells. The patient can either take it in a pill form or have the medicine injected straight into the veins. The next is surgical treatment. This requires an operation where the cancer tissue is removed. The next 3 are hormonal therapy, radiation therapy, and biological therapy. The final and least common treatment are drug trials and clinical trials. Keep in mind that each treatment has different side effects. So, what exactly are clinical trials? Well, clinical trials are studies performed on people to research various types of medicines or sometimes even operations. There are 4 phases used in clinical trials. Phase 1 evaluates whether a new treatment is safe enough to be used and tested on people. Phase 2 studies whether the drug can actually be an effective treatment. Phase 3 then compares the effectiveness of the new treatment to the standard treatment. And the final phase, Phase 4, studies the long-term side effects of the treatment, and the treatment must be approved by the Food and Drug Administration. Next, let's go over the survival rates for patients with breast cancer. The 5-year survival rate, which is 5 years after the patient is diagnosed, of a female with invasive breast cancer is roughly 91%. The 10-year is about 86%, and the 5-year for a male is 84%. The average for cancers that spread to the regional lymph nodes have a 5-year of 86%, and cancers that spread to distant part of the body have a 5-year of 27%. However, the 5-year of a female that has cancer only found in the breast is 99%. Unfortunately, you can get breast cancer again, so it is important for survivors to look for the signs and symptoms of the 3 types of recurrences. The first is the local recurrence. This is when the cancer is found in the same area as the original cancer. Signs and symptoms of local recurrence include nipple discharge and skin inflammation. The next is regional recurrence. This is when the cancer has come back in the nearby lymph nodes. Signs and symptoms include swelling under your arm or near your collarbone. The last recurrence is distant recurrence. This is when the cancer has traveled to distant parts of the body, like bones, liver, and lungs. Some signs and symptoms include persistent coughing, difficulty breathing, and even seizures. There are some strategies that have been linked to reduced risk of breast cancer. Some include hormone therapy, chemotherapy, exercising, maintaining a healthy diet, and maintaining a healthy weight. As we've learned, breast cancer is a common cancer that affects thousands of men and women each year. Although a patient is relatively healthy and shows no early signs of breast cancer, they can still be at risk. It is important to know the signs, symptoms, and risk factors of breast cancer. Women should perform a self-exam often and go for a yearly exam given by a healthcare professional. Thanks to modern technology and medicine, the survival rate for breast cancer has never been higher. We spread love and hope each year by honoring Breast Cancer Awareness Month and continue to contribute to new research and treatments that can help thousands more. We look forward to one day living in a world where no one has to lose a loved one from this horrible disease.